Well, hello, everybody. Good afternoon. My name is Garrett Schmidt. I am the CEO and managing editor for VBC Exhibit Hall, and I'd like to welcome you all to today's live webinar that is hosted by TCare. It's the first one we've done together, so very excited to introduce them to you. And this one is called The Crucial Role of Professional Caregivers Post-COVID, Prioritizing, Retaining, and Growing the Workforce. And I got a little bit of a sneak peek of what's going to be discussed today, and so I think you will really enjoy the presentation. A few items of note before we get started, just some housekeeping stuff. Everyone is joined today in listen-only mode, so this is a traditional webinar format, so you don't need to worry about turning off your camera or muting your microphone or anything like that. That has been done for you. We are going to have a time for some Q&A towards the end, so if you have a question at any point during the presentation, you can use your control module as the attendee to ask that question there, which is different than the chat. There's actually a little space for questions, so you can go ahead and drop that in at any point. You don't need to wait until the Q&A, but of course I'll prompt you again then. Also, the session is being recorded today, so when we're done, you will receive an email probably about an hour or so after we conclude, and it'll be a link to the presentation itself as well as to the slides that you can download. We're covering a lot of material today, and that way you can review it and share it with colleagues and friends, and we hope that you do. So without further ado, wanted to briefly introduce our speakers, and then I will turn it over to them. With us today, we have Mr. Ron Schaefer, and he is the Chief Operating Officer with Lutheran Senior Services. And we also have Ms. Jody Fenner, and she is the Vice President of Growth and Execution at TCare. So Jody, I believe you're going to get us kicked off, so I'll turn it over to you now. Welcome, guys.
Absolutely. Thank you for that introduction, Garrett. As Garrett mentioned, I work for TCare, and at TCare we provide comprehensive evidence-based programs and supports for caregivers across the country. For over 20 years, I've worked in the long-term supports industry, served as a developmental disabilities director for quite some time, as well as worked for a large national managed care organization managing programs for people who are aging and those with disabilities. But most importantly, I'm a caregiver for both my parents and previously for my grandfather. So I know firsthand the crucial role that both family and professional caregivers play in supporting our nation's most vulnerable people, and I appreciate the work that you do. Today, I am joined by one of our most valued partners, Ron Schaefer. As Garrett mentioned, he's the Chief Operating Officer for Lutheran Senior Services. For over 160 years, LSS has supported aging adults and their families with a wide array of options to meet their preferences as well as their needs. And today, they offer the full continuum of care, both supporting people in their homes with HCBS, home and community-based services, as well as independent living, all the way up to long-term facilities. And they do this across Missouri, Illinois, and Pennsylvania. Ron personally has over 30 years experience in nonprofit senior living. He's leading mission-focused innovative organizations like LSS, as well as serving as an educator for the next generation of leaders through his work at the University of Southern California School of Gerontology. We're going to cover these topics today. We're going to talk first about the state of professional caregiving post-COVID, and then really affirm the role of caregivers as the backbone of our national aging and disability systems of care. Then we're going to talk a little bit about our evidence-based innovative approach, and Ron's going to share with you directly what they've been doing at LSS to retain and onboard caregivers. And we'll close with an overview of the value of reducing caregiver burnout. Today we're going to do a modified panel. Ron and I are going to engage together, and as mentioned, we'll have an opportunity for questions at the end. But first, we want to know a little bit about you. So Garrett is going to do a quick poll.
All right, so you are going to see on your screens here our first poll for today, so you can play along at home. And this is, what is your connection to professional caregiving? So this is choose one that best applies. Are you a professional caregiver or family caregiver? Are you a provider organization? Are you from a state agency or community stakeholder? Are you a payer? Or are you something other than that? And we're going to have another poll later on, and these are anonymous, by the way, so you can answer honestly. We're going to actually show you here soon the results so you can see where you stack among your colleagues, see who's interested in this topic. So we got the results are still coming in. So we're going to give it another few seconds, and then I will read out the results because I think Jody is limited in her view and won't be able to see those results, but I will read them out for you. Okay, I
Appreciate
think
that.
most, yeah, sure thing. So I think most of the results have come in now. So I'm going to go ahead and shut it down in 5, 4, 3, 2, and 1. Okay, so we have, looks like 0% of you are professional caregiver or family caregiver. Um, we have 71% of you are with provider organizations, okay? And 6% are with state agencies or our community stakeholders. And we've got, doesn't look like we have any payers with us today. And then we've got 24% are something other than that. So very interesting.
Great. Exciting. Well, thank you all for joining us. Before we talk about the state of professional caregiving post-COVID, I want to reflect first on why COVID had such a significant impact on our professional caregiving community, particularly those serving people who are aging and those with disabilities. We already had a workforce crisis. That wasn't new. That has been a decades in the making, and Ron's going to share a little bit about that in a minute. But when the public health emergency was announced, at the time, I personally was working for a large managed care organization, sitting at a desk in Iowa, and was basically got a phone call. It said, the president has declared this emergency, go get your suitcase and go home. No delays, no questions, go home. The reality is that my team supported people with disabilities and our aging services across 16 states, and overnight, those services closed. In California, for example, within 24 hours, all the adult day centers just shut their doors. And this is where most of our seniors, they get not just social experiences, but that's where they were getting their meals and a lot of their attendant care. And these services were basically deemed non-essential. Understand that was, there were calls that had to be made, but the reality is that left families and teams really struggling to make sure people had their supports. It just created an intense stress on everybody in that caregiving system. Ron, I know your team was really on the ground in the front lines of the crisis. You did some really amazing things and was one of the organizations, quite frankly, that excelled at continuing to support people. I'd like for you to share just a little bit about how COVID impacted your staff.
Well, it was, first of all, COVID was just a horrible time. And just to rewind everybody's thoughts for a second to January, February, March of 2020, we were laughing yesterday, Jody and I, about how when we went into this, we thought, well, this will be over in 3 or 4 weeks. And obviously, that was just incredibly naive. But I don't think we were unique in thinking this was going to be a short-term challenge. And I will say, at least in the, other than perhaps the acute care part of the spectrum of senior care, everybody else was completely unprepared for what would be demanded of us in very short order. We didn't go into COVID being a, CDC certified biocontainment unit. We are now, and we know how to do that, but we had no idea how to do the things that we were being asked to do in January, February, March. And on top of that, so many of the resources that were in the United States were being prioritized to the acute care hospitals, and for good cause. That's where the deaths were happening. That's where people were going when they needed support from infection. But we couldn't get masks, we couldn't get gowns, we couldn't get gloves. We jokingly called it the great PPE hunt of April 2020, of very sketchy efforts to buy, cash on the barrel from some guy in downtown LA, 4 crates worth of N95 masks. And that actually happened with my organization. And that level of anxiety, that level of unpreparedness, certainly caused anxiety at the administrative level, but it echoed very strongly down through all of our caregivers as well. because they knew we weren't prepared. They knew they weren't prepared, and they also knew that they were the ones that were front and center if there was a COVID outbreak in our community, that it wasn't going to be, the people in the administrative work that were in those resident rooms on a daily basis. It was going to be them. So their anxiety, their nervousness, we talk about them as being heroes, and I think we overuse that phrase most of the time. During COVID, they really were heroes. Not only did they show up to work, knowing that they could potentially become infected with a disease we did not understand at all in the early days. And even after we understood it, we understood that it was continuing to adapt and to mutate. And some of the later strains were just as deadly, if not more deadly, than the first strain. And then we were saying, we need you to work longer hours because we need more caregivers for the workload. And there were no caregivers to be hired into our organization. And then on top of all of that, and our folks doing a great and heroic job, we also often don't think about the fact that at the end of the day, they had to go home to the people they loved. And we're not sure if they were carrying a deadly disease back into their own home and could potentially be the cause of injury or illness or potentially death for the people that they love the most in this world. And so when we use that word hero, I think it's very applicable to that time in a way that it hasn't been applicable in a lot of other times. The long-term effect, though, coming out of COVID, that we continue to see is that people that just either their organizations shut down and they were out of work or what have you, a lot of people said, this is an opportunity for me to go to gig work. And so even as caregivers, even as nurses, a lot of people decided to go work private duty or agency where they could make a little bit more money than what we could afford to pay them. And they had more flexibility. And so we really didn't understand how to retain our employees very well during that time. And at the end of the process, one of the things that we made a commitment to was to learn how to support our employees as a whole person, that they weren't just the 9 to 5 or 3 to 11 employee, that because what happened at work also affected home, and to leave that home, that safe place, in order to come to work and face unique challenges, that we had to figure out how to play a bigger role in their life to support them. And so we began to look at a lot of solutions that were more whole person support solutions in order to try to really save the people that were already working for us, first of all, so they understood how much we wanted them and needed them and appreciated them, but also how badly we needed them to stay, because as we saw turnover increasing coming out of it, because they could honestly make more money at a hamburger stand in a lot of cases than they could working in our communities. It became a real challenge to have a full complement of staff. And, some of those things still echo today from those early days. I would say that we probably, as an industry, probably, although we give lip service today better than we used to, I don't know that we really respect our frontline caregivers as much today as we did when they were going in and facing the virus every day. And so they're coming out of this, and I don't know that they feel the respect the way that they need to. I don't know that they don't have the anxiety of working shorthanded most days. I mean, that's still part of most organizations' experience, is that we have either an addiction to agency or we work short-staffed. And so some of those things continue to affect what amounts to, I think, professional depression, which is just another way of saying that people are depressed and they carry a lot of burdens, and some of those are burdens that we as providers can cause, even unknowingly, that can contribute very heavily to that burden of depression. But I think the impacts of COVID were strong during COVID, and I think that they have shifted a little bit afterwards, but there's still a very strong theme of we are not back to a normal situation yet, I don't think, when it comes to post-acute caregiving.
I would agree. And I know I promised we weren't going to be heavy on statistics, but I would like you to kind of share, where are we today with the workforce crisis, and
Well,
it's
Jody, I'm
one.
afraid I'm afraid it doesn't get better news. Uh, and I think that's actually taking a sober look at where we've been and taking a sober look at what's coming is a really important thing for us to do today, because we're going to get to that, I think, at the end, towards the end of this, but there are things we can do that make a huge difference in the lives of our caregivers to make them want to continue to support our mission. But looking at where we are today, and it's here on the slide, our population is growing. There's no doubt about it. And we have this huge bubble of people that are known as the baby boom generation. And they are just in the last couple of years starting to exit the workforce in significant numbers. The first of them exited a while ago, but they've sort of moved along, and that bell curve is moving closer. The peak of it is getting closer and closer to retirement age. And as they leave the workforce, the reality is that there's fewer people at later generations coming into the workforce. And if you look at the differential between 2007 and 2024, we have over 800,000 net fewer employable people in the workforce of the United States today over the last, 14 years? I can't do the math. 27 years. Why can't I do that math? But that it's not 27. I'm so sorry. But that loss of workforce is a real, actual people coming out of the workforce. We have 800,000 fewer people looking for work today than we did in 2007. And the way that is also compounded is that we also happen to be in an environment right now where we don't have a lot of open available ways for people to come into the United States legally, which in a lot of provider settings, we cannot use undocumented labor. We have to use people that are credentialed to work in this country. And there are fewer and fewer people that are available for us to bring in from even our partner nations like we did in the 90s and the early 2000s. That just has been a change in the United States policy. So the workforce doesn't have a backup plan, and it's getting smaller. And what's happening is that over time, we're having fewer and fewer people available to be caregivers as that older generation is aging into getting older, becoming more of a needs-driven life situation where they need caregivers, they need hospitalization, they need ER, to be open, they need caregivers at home, they need institutional care through assisted living, memory support, skilled nursing, whatever it may be. The need for caregivers is growing, and the number of people available to do that is right now about 6 caregivers per patient in our workforce. That means there are 6 people who are in the workforce right now who could be a caregiver, either personally or professionally, for every one person in this world, in our society, that needs that care. When we get down to 2030, which seems like a long time away, but that's 5 years from now, that's going to be down to 4 caregivers in the workforce per every patient. Adding another 20 years past that, if we're really willing to look down the road to 2050, we will have in the workforce, if nothing changes and these trends hold true, 2 caregivers for every patient in the United States. So what that tells me, I mean, that's dire. But what that tells me is that our workforce situation, our caregiver situation, is not going to get better. It's not going to get less expensive to provide those supports. And so we have to look at what do we do, what can we do in either our institutional types of care or any other type of care situation to help those people that are doing that super difficult job. And let's be honest, most of caregiving is not fun. It has its rewards, but it's not a glamorous job. It's hard work. It carries a lot of burden, a lot of stress, and a lot of responsibility. How do we help those folks continue to want to be a part of our mission and to stay with us and take care of the people that we're trying to reach as a part of our mission? And right now we serve about 3,800 seniors in a care setting. across the United States. And that takes an awful lot of caregivers to do that. And so how do we get to the place where we can have certainty about being able to field a full complement of staff to be able to meet those needs? And that's going to become a greater and greater challenge going forward, which is to circle back to what the lesson that I said we learned during COVID is, how do we take care of people as a holistic whole person, not just during their shift? And I think that's where really our partnership with TCare came out of that search, as well as other benefits that we've invested in on behalf of our employees.
Yeah, it really is so overwhelming. When we were walking through these numbers prior, it just occurred to me, when I need a caregiver, in 20 years, 30 years, they may not be there. So really happy that we see this as an opportunity to do something about that. I love the way that the holistic approach. The reality is that what we did in the past isn't going to work today. We can't just view our employees like cogs in the caregiving machine. As Ron, you've noted, the pandemic put our caregivers in such a spotlight and illuminated the need for a paradigm shift. We have to do things differently. And forward-thinking organizations like LSS are embracing this holistic approach to workforce management. We have new models that recognize the employee as a whole individual with interconnected needs. Programs like TCare are pioneering the shift and offering comprehensive support to reduce burnout and stress and anxiety and help foster that resilience and job satisfaction. And we have been so grateful to partner with Lutheran Senior Services, because we just are mission aligned, but really to see that holistic approach to workforce management. Before we go in, and we are going to talk about what Ron and his team have done at LSS, I do want to do just a brief overview of the TCare model to give you just a little bit of background. So TCare at its foundation is an enterprise platform, and we provide tailored care management for caregivers across diverse populations. We address a caregiver burnout, we help manage service utilization, and really help keep people at home, if that's where they want to be, by improving the well-being of caregivers and those they care for. We really exist to make caregiving a more manageable and fulfilling experience, whether that's family caregiving or professional caregiving. And we believe in empowering caregivers through understanding, education, and really custom person-centered support to assure that no caregiver walks alone in their journey. When we did the poll earlier, I know we all probably chose our professional items, but I'm always surprised at how few people identified themselves as caregivers. We do work across different client segments. We have a lot of work we do with managed care organizations and health plans. What we do there is we wrap around their specialty at-risk populations and help those caregivers, again, trying to help keep that care at home by reducing that caregiver stress. We also work licensing our protocols and programs to area agencies on aging and community-based organizations across the country so that they can use the TCare evidence-based programs to support their caregivers. And then we work with employers and groups like LSS, but also other non-direct support professionals to support their workforce. Caregiving has such an impact on all employees, not just professional caregivers, because it impacts your FMLA utilization. It impacts, quite frankly, can your staff pay attention and do a good job at work and not be burdened by the caregiving stress that they have at home. And then we also have some insurance products that we work for that include core services and caregiver expense protection. We recognize that it isn't just that all caregivers are different, but the type of caregiving they deliver may impact their needs. And so we have comprehensive solutions tailored to meet the diverse needs of caregivers based on the people they support. Our foundational family caregiving program started with aging and dementia, and we've built on that to support people in the child welfare environment, physical and developmental disabilities. We have a national veterans program that we partner with the Disabled American Veterans on. We're very happy to do that. And in this recent year, we've expanded more to the professional caregivers and frontline staff. And some of that was more generic than actually intentional, because what happened during COVID is a lot of those family caregivers are now paid family caregivers because state agencies and providers, they don't have the staff to care for them. So a lot of family members during COVID became professional caregivers without ever intending to choose that work. I'm not going to go through our whole clinical approach, but this is just a high-level overview of what we do. We take the information that we've learned from caregivers, and we use that to develop caregiver burnout interventions, strategies to help caregivers reduce their stress. And number two, I go back to this, is helping identify caregivers. It's amazing how many people, and we really saw this at LSS as well, they don't think about what they do as caregiving. They don't label themselves that way. And what that means is then sometimes they don't access the supports they need to support themselves. And that's where we come in. We deliver tailored caregiver support plans. We have evidence-based assessments and screening tools, but the real secret sauce to what we do is that one-on-one connection that our TCare specialists have with the caregivers. And it is that routine relationship building and support that really drives, number 4, our analytics and insights, our outcomes. And what we do is it's just a continuous flywheel. We're always looking at what is impacting the caregivers, and then we take that insight to our partners like Ron and team and help recommend, benefits, strategies, tools that they can offer in the workplace to kind of help close that caregiver need loop. And why professional caregiving? And this was sort of alarming to me, but 57% of our senior care providers have considered leaving their job in the last year. And as Ron shared, we can't afford to lose anyone. We need more staff, not less. But that stress and burnout that they're experiencing in their day-to-day work is impacting their job satisfaction, quite frankly. 56% of respondents in nursing home and assisted living facilities report being burned out. I think you described it best. It's that almost the professional depression of the impacts of not just the job they do, but it's like we never got a break after COVID, and it's not really getting any better. So we use our evidence-based platform with our digital tools and tailored care plans, but that concierge care really does reduce the prevalence and impact of the caregiver burnout. So by battling the caregiver burnout, we partner with organizations to engage their employees and caregivers to alleviate their stressors and support that well-being, both at work and at home. I think before we pass it back to you, Ron, we want to do one more poll.
Okay. Yes. Let's pull up this second poll here. For those of you who are just joining us, you can play along at home, and you're going to see this on your screen momentarily. Here we go. What are things you are doing today that may relieve caregiver burnout? And this is choose all that may apply here. Or to, I guess, to reword the question would be, what things would create the most relief for caregiver burnout, and or what you're doing in this regard? Is it caregiver benefits beyond the required FMLA? Is it EAP resources? How about flexibility or hybrid or work from home options? What about virtual coaching or social emotional support? Or the last option is employee recognition programs or team building activities. So go ahead and take a moment. Again, what are the things that your organization is doing or that you think would be helpful to relieve caregiver burnout? And we're going to give it a few more seconds here. Looks like we've still got the results coming in. And again, if you're just joining us, these are anonymous, by the way, so we're going to show you the results here in a moment, and you can see where you stack among your colleagues. this can kind of just be interesting in terms of seeing what the thoughts are. Okay, so we're going to go ahead and wrap it up in about 10 seconds, and then I'll turn it back over. All right, I'm going to close it down in about 5, 4, 3, 2, and 1, and show you the results. Here we go. Okay. So Jody, I know you can't see them on your end, so I'm going to go ahead and read out the results here. And we have 33% of you that said caregiver benefits, 42% EAP resources, another 42%, and this is check all that apply, so this is not going to add up to 100. Another 42% of you said flexible scheduling, hybrid, or work from home options. 8% of you said virtual coaching or social and emotional support resources. And then another 42% said employee recognition programs or team building activities.
That's great. I love that. I think the point here is it isn't any just one thing. You really have to look at a broad approach, and you have to customize that to the needs of your teams. Ron, I am going to pass it to you. I lost light in here. Ron, I'm going to pass it back to you and tell us a little bit about how you implemented TCare, how it works with your other programs, and the resulting expansion and really lessons learned. What would you do differently today?
Yeah, so this is really a great story because when we first were introduced to TCare, we were doing a lot of these things that everybody else is doing, and we're doing them well. We have an employee assistance program, and it's been there. It's well known. It's accessible to our employees. We do an internal wellness incentive for people to keep their physical bodies healthy and their blood chemistry in good order. We have, depending on the position, varying degrees of work remotely, flexible scheduling. To the extent we can accommodate that, we have a lot of the things we do employee recognition programs and try very hard at a very local level to do team building at each of our locations, so that people can enjoy being around each other, other than just going through the punch list of what do I have to do today at work. And we were doing a lot of things right. But when we learned about TCare, we said, all right, let's try this. And we had some skepticism. We weren't sure that at its face value, we thought, how is this better than EAP? It seems to be a lot like EAP. You've got somebody somewhere on the other end of this benefit who is available to help support an individual going through a challenge. But very quickly, what we found was that there's a huge difference, and one doesn't replace the other, but it's an incredible complement. And so what we did was we started with a pilot, starting in our skilled nursing facility at one of our communities, and went through and made it available to our caregiving team. First of all, it was just our CNAs. And then as it got going, there was a lot of appetite as the LPNs and the RNs were like, well, maybe that would be good for me too. So we expanded the pilot a little bit. And then it wasn't very long until people from other departments were like, well, I want to get in on this too. And it sort of grew at this community and became a thing. And people started going through the process. They got the mobile app, which was very easy to use, and they were doing the burnout assessments and going through and realizing, oh my gosh, I'm carrying more stress and more difficulty perhaps than I was actively aware of. And here's some things I can do about it. And in some cases, people were actually being put in touch with a social worker, another human being on the other end of the line. And comparing and contrasting that to what they had available in the EAP program. And I've used EAP at other organizations, and I know how it works. It's not easy to find a caregiver, a provider, a mental health provider, or a legal provider, or whatever the EAP program provides. It's a waiting list, and it's somebody that you don't know where they are, how excited they are to talk to you because they realize that you realize they're not going to get paid as much through EAP as they are in their private practice, and it has a role, and it can be a longer term solution for a lot of people in a very healthy way. But if you're dealing with something today, it's not a very accessible solution. Just like trying to call up the phone and get an appointment at your primary care doctor or your dentist today. It's not easy to do. But with T-Care, what they found was that there was an immediacy of responsiveness that was making a difference in today when they were having their feelings of challenge, when they were feeling overwhelmed today. They were getting active solutions, active support, active understanding that and recognition of what they were actually going through. And so that pilot very quickly became a bigger and bigger expansion to the point where after I think about 8 or 9 months, we opened it up to all of our employees. And so as we went through that process, it was a pretty rapid expansion of our pilot. And I think I would say it's been a very successful expansion of that pilot too. And it remains, from what I hear, I still get people just coming, oh, you were involved in helping T-Care come to us. I just want to say thank you, Ron, for being a part of that. And really, it wasn't me, it was our HR team. I just made the introduction, and away everybody went. But I think it's been a very successful rollout, and it's been incredibly well received by our employees. And I have stories of people who just they were involved in the T-Care situation, and had a contact and had something else come up, a crisis in their life, and they needed emotional support, and they were able to call the social worker on the other end of that phone, who was not there necessarily for that crisis, but who was an incredibly beautiful support to them and that family as they were walking through a new crisis in the moment, and then ultimately helped them get the resources to get to the longer term needs and care that they needed. And you just can't do that through the more institutionalized tools and resources that we have, and they all have their place, but there's something really remarkable, special about the way T-Care is in somebody's life immediately, making a difference almost from the very beginning.
What today, Ron, if we had to start all over again, excuse me, what would you do differently?
Well, I'm not a big fan of pilot projects. I'm like, either, you're in for a penny, in for a pound. So I probably would have done a more rapid rollout, but I would have started more with understanding within our benefits team, a little bit more rich understanding from their perspective as to how it was different than the other benefits that they've been so wonderful to bring to our employees. Because it really does play a unique role. And that wasn't clear. I wasn't able to make that clear early on. And I wish I had been able to really articulate that in a way that would have developed more champions in the very early days to get this more broadly implemented across our organization.
You have had some pretty amazing success. I'm gonna move on to that slide. And I'll let you share the lovely news. I love it.
I'm still seeing the same slide. Here we go. Yeah. So this is I will say this: T-Care from a user's perspective is just a really authentic, accessible, very human feeling benefit. Very human feeling. But behind it's actually some science and some real statistics and some real studies about its efficacy. And we went through that process with LSS as well. So these numbers come largely out of our pilot project, and what we found was that 90% of our employees who engaged with T-Care 6 months later were still actively involved in using the benefit to monitor their level of burnout, to look for solutions for emerging crises and pressures and stressors in their life in a way that helped them stay healthy and complete as a human, emotionally and physiologically. what we also saw was that there's a huge improvement in retention between our employees who have not been engaged with T-Care and those that have been engaged in T-Care. And the statistic we found was that there's about a 1/3 differential of people that choose to stay. More people, a third more, stay with us having gone through that benefit and being engaged with it than if they had not encountered it. And that might seem like well, it's not 100%. It's a third, but it's a huge third. Not only does it save us $8,000 per person to replace, and that's our number that we provided. That's what we know it costs us to replace a non-leadership position when it turns over. But also when you think about the statistics of going from 6-to-1 to 4-to-1 to 2-to-1, every employee that we can keep in our mission, helping us serve the people who we are here, our purpose is to take care of, is just another person that is helping us find success every day that they show up with that individual and their needs. And that reduces our need to go out to the marketplace to try to recruit somebody away from perhaps one of the people on this call. So if we all did this together, I think we'd all be a lot better off and wouldn't be cherry picking each other's employees necessarily. But this is a huge impact for us, and for the first time, and this is related, it's not related, it's woven into the statistics, but our retention year over year has been increasing. Coming out of COVID, the last 2 years, it's been increasing year over year, and I know this is a piece of it. And while we have a lot of employees that aren't necessarily caregivers, this piece is significant for us because the caregivers are the ones that, we don't have to clean that hallway every day. We can clean that hallway every 3 days if we have to. We don't need me to sit in an office and do meetings all day, but we sure do need a caregiver to show up and take care of the people that we are pledged to serve. And this retention and that knowing that not only are they staying longer with us, but they're also getting some of their real core needs met that go beyond their shift is hugely important to me and to our organization.
I'll also note, because you actually opened the program up to all of your staff, not just the direct caregivers, this 35% is the average impact, but the rate for the direct caregivers was actually quite a bit higher. And those, for whatever reason, we were able to have a little higher impact on those versus office staff. But I think 35% is a great rate. More
well,
importantly,
my math minor is not working for me today, so I don't remember what the other percentage is either.
Yeah, it was, and we just showed the average, but it really goes down to, making that employee feel supported, but also really connecting them to real services and supports, because one of the things you talked about earlier in the conversation is the struggle with pay, right? A lot of the folks are CNAs, they can go to work at Target making more money than we pay them. And that's not a lot there's not a lot that we can do to change that. And what we found in this past year, especially, costs have been increasing, cost of living, and a lot of staff that we see in our employer programs, while they have good working jobs, sometimes they just need other supports. And so a lot of what we do really is psychological, social, that wrap around real person support, but we do connect people to real services too, as well as, husband loses a job and now they find themselves needing energy assistance or some sort of other social service. And so we do that a lot, especially with some of our frontline staff. So this caregiver highlight is just one example of a common theme that we're seeing with our employer programs, and that relates to the rising experiences that caregivers have supporting their family members with mental health. This is a highlighted case where we were able to really connect a mother's, help her connect her daughter to local behavioral health supports and help support her through that process as she was, quite frankly, supporting her adult daughter. want to wrap it up here in the last few slides so that we can take some questions, but really, what is the future of caregiving? And I think we have to embrace technology. Ron, you said it best, we can't grow more bodies, and we're having a challenge, bringing caregivers into the system with the human capital that we have. So how can we use AI technology to support the caregivers we have, making their tasks more efficient and really giving them more time to provide that compassionate hands-on care? There's a lot of things out there. I know your organization uses some great technologies, but it really has to be a part of our solution. And prioritizing well-being, really employee wellness is a core part of your culture, offering programs that support caregivers' overall well-being and driving that resiliency and helping them stay in their roles. And innovation in funding. For those of us in the human service industry, we have the new access rule coming out. There's a lot of push around transparency in capacity and staffing levels that we're going to have to drive to. And what we're going to see there is the financing is going to be connected to your capacity work. So I was with a couple of thought leaders a few weeks ago in various states, and they basically said, yeah, we are going to prioritize value-based payments for things like recruitment and retention and capacity building for our long-term service providers. So a great opportunity to know that this isn't just all on your back. There hopefully will be ways to help fund that and support that. And really reimagining care models. I know, Ron, you all did this a lot through COVID, looking at the movement towards home and community-based services and how you use your community resources and technology. And I think we'll have to continue to evolve our care models to ease the burden that traditional facilities have really held that bulk of the load. Seeing more of that go to home and community-based services, we're having to adapt. And it's where people want to be supported, but it does require more caregiving. And so,
Well, I see this a lot. I don't know anybody that says, when I grow up, I want to live in a nursing home. I mean,
yeah,
that's not so. So providing support at home for as long as it can be safe and successful is a great trend, but it also is less effective, or at least less efficient on the staffing than institutional based care. And so all of the staffing numbers that I shared with you are going to be somewhat exacerbated by the move towards in-home care, because that person is only available to serve one person during their shift, not 7 or 8 or 12. And so it's a lot more complicated, but I think it's a better approach to the care that we as humans want and deserve, and it certainly is more in line with the way that we want to envision those years in our life when we get to that place.
agree completely. So finally, empowering change, your role in transforming caregiving. Explore solutions. T-Care is an option. There are other options. Some of the services that we talked about in that holistic package, that there's a lot out there, and really exploring that by engaging with your team. Every organization is different, your teams are different, and I think this is something that LSS has done really well, is you didn't just bring solutions, you actually talked to your teams about what matters to them, what's important, what are their challenges, and matching those solutions to what your team needs. And then really assessing your organization's need. I think, Ron, you said it best, you've been working really critical at narrowing that turnover rate, because you know the value of your teams and you can't afford to lose them. So really looking and identifying any gaps, consider where solutions like T-Care can have the greatest impact, is important. And then really just taking action. We can't wait till 2050. We have to start making changes now to support the program needs, or well, there is no or, we just have to take action now. So really encourage you to reach out, and we're a partner if that's an interest, but also partners with other organizations like Ron. Really appreciate that. I think we're ready for Q&A.
Okay, yes. Well, first of all, thank you guys. This is a fantastic presentation, and we do have some questions here, so we will dive in. If you do have a question for either of our speakers, go ahead and drop it right now into your question module. There's a place on your attendee module for questions. And we're going to get to as many as we can. If we don't get to yours, don't worry, someone will reach out via email. So, in no particular order here, question number one is, what was the most challenging part of implementing T-Care for the LSS teams?
Um, I don't. To be honest, the most challenging was fitting in the pilot and getting it launched in the middle of all the very, very busy work that our team does all the time. And so it was just a lot of extra for the team that brought it to life within our organization. And so, we tend to be a company that moves fast, and we've always got new things going. And so trying to fit in one more new thing was a challenge, and it took a while for it to find its stride so that it didn't feel so much like an extra. It felt more like a routine internally. I would say that from like an HR and community leadership perspective.
And I think we learned some things in that implementation, like especially because in this industry we have staff 24/7. So creating like video content to help staff be aware of the program, things that where we can actually connect and engage again, because you do have it's a 24/7 staffing model. So I think we've together created ways to really be more responsive to those staff needs.
Great. Next question here is, have you noted trends in the needs of professional caregivers that are different than T-Care's traditional family caregivers?
Yeah, absolutely. The reality is these caregivers, they are caring for people, some of the most vulnerable people with challenging needs during their entire shift, whether that's a day shift, an afternoon shift, or an evening shift. But then at the end of the day, most of them go home and they don't get to brush off the caregiving duty. So they don't get the downtime that somebody else is. I kind of liken it back to many years ago when I had children and went back to work. I mean, sometimes my work was a respite from my crazy chaos at home. But these caregivers don't get that luxury. They never get to turn that off. The other thing I would say is um, going back to Ron's comment earlier, the pay for some of the CNA, especially the frontline direct support staff roles, has not kept up with the national cost of living. And so a lot of what we have found for this population is really connecting them to economic supports, helping them with planning and a lot of social determinants of health that we don't always expect when we work with some of our employer cases. Yeah. And Ron, maybe, yeah, I don't know, that would be my answer.
I mean, I also think there's a lot of similarities, to be honest. I think the pressures of work today affect us all. I think what may be unique about the caregivers is that, and this has always been true, it's even more true for people that are in a home-based situation, but the level of responsibility for another human being's well-being is tremendous in that caregiving role in a way that's different if you're in a dining service role or if you're in a maintenance role. Yes, there's a lot of responsibilities in every job, but I think that perhaps those burdens rest differently with people that are in that caregiving role, whether they're a nurse or an aide or a med tech. I think that they just rest differently, which I'm sure is why that's where T-Care chose to begin.
Yeah.
Wonderful. All right, next question here is the experience different for the office staff versus the frontline and clinical staff?
I wouldn't say the experience is different. I think a lot of it depends on the caregiving role, because what we found, and think, Ron, you just alluded to it, a lot of the office staff and the non-direct support staff, they are caregivers at home, and they also feel a responsibility to support the organization. And I think a lot of that is the great culture at LSS, but so there are a lot of commonalities. But then obviously there is a difference in just because their work experience is different, right? But we do the same support for all of them, both the office staff and the direct support staff.
And I think, perhaps in the office staff, the work that is being done feels a little less like a cohesive team as it does more colleagues that are doing similar work at the same time. And so maybe there's more individual isolation feeling of, I'm not on top of my project, or I'm not on top of my deadline in an office setting, perhaps. I'm guessing here, but that's something I could see being plausible.
Wonderful. We have time for just a couple quick questions more. Next one is, how long do caregivers typically stay engaged with TCare?
It really depends on the preference of the organization. We can do shorter time frames, but what we find is if we can develop that long-term relationship, we can be there when the caregiver needs us. And it really is relational. We showed you the statistics earlier. To date, the majority of the individuals who come into the program stay in the program for more than 6 months. And like I said, that has really been helpful for us to be responsive when the caregiver needs that support. We base our outreach and our engagement with caregivers on their preferences, but we do routinely connect with them and make sure that we're measuring those stress levels and helping them identify strategies to address them. So oftentimes it is quite long term.
Beautiful. And last question here, if we can answer it quickly, is, are there any HIPAA concerns for identifying caregivers? And if so, how do you overcome those?
Well, we absolutely honor HIPAA. And when the way we have handled it at LSS is Ron offers it to all of the teams. And really, everybody is a caregiver, and not everybody. Most people are caregivers if you really sit down and think about it. But from our perspective, we have our platform is HIPAA credentialed, and our staff are clinical, and they are trained in privacy. We don't share their privacy data with Ron and his team. That their care plan and their data on our platform is just between us and the caregiver. We do not share that with our clients.
Yeah, I couldn't tell you one single employee by name who has engaged with TCare at all.
Yep.
That's great and very important. Unfortunately,
unless they told me personally. Yeah.
Unless they told you personally.
Yeah.
Well, we are out of time, folks. This is a fantastic presentation, Jody, Ron. There was a lot here, and we know that there's going to be more audience questions that may come up. If we didn't get to yours for some reason, someone will reach out to you via email to make sure we answer your question. But as we close out, wanted to encourage you all to head over to VBC Exhibit Hall and check out the TCare virtual exhibit booth. And Jody, if I could have you go, yeah, there we go, to that next slide, and you'll see a little picture of it there. And on the slides, there'll be a link to it. But you can go there and read up on them and what they're doing, and educate yourself a little bit more on what they're doing in the space. There's a lot of great resources there. And in the archive library at VBC Exhibit Hall is where you'll be able to find, if you needed to come back and find this webinar, as well as some other webinars that are informational and educational. A lot of things there for you. And then finally, if you would like to reach out to our speakers today, feel free to do so. On this last slide here, Jody, I think there should be the information to reach out to them directly. And there it is. There's Jody's email, and she will answer any of your questions and direct you in the right way. And I'm happy also to facilitate an introduction if that's easier for you. So feel free to reach out to me as well. Thank you all so much for spending your afternoon with us. And if you don't join us between now and the new year, have a happy, very happy holidays to you all. Thanks so much. We'll see you next time.
Thank
Thank you.
you.
Bye bye now.